Vitamin D. The sunlight vitamin nurturing health. 1. Introduction. Sunshine nutrient. Vitamin D, often referred to as the sunshine vitamin, is a crucial fat-soluble vitamin that plays a multifaceted role in maintaining optimal health. While sunlight exposure is a natural source, dietary sources and supplements also contribute to meeting the body's vitamin D needs. 2. Importance of vitamin D. Bone health. One of the primary roles of vitamin D is in the regulation of calcium and phosphorus absorption, essential for the development and maintenance of strong and healthy bones. It aids in the formation of bone tissue and helps prevent conditions like osteoporosis. Immune system support. Vitamin D is known to modulate the immune system, enhancing the body's defense mechanisms against infections and illnesses. It plays a role in both the innate and adaptive immune responses. Cell growth and regulation. Vitamin D is involved in the regulation of cell growth and differentiation. Adequate levels contribute to the normal functioning of various cells, including those in the skin, immune system, and organs. Anti-inflammatory effects. Vitamin D exhibits anti-inflammatory properties, playing a role in mitigating inflammation and supporting overall immune function. Chronic inflammation is associated with various diseases, and vitamin D may contribute to its regulation. 3. Sources of vitamin D. Sunlight exposure. The skin can produce vitamin D when exposed to ultraviolet B, UVB, rays from sunlight. Spending time outdoors, particularly during midday, aids in natural vitamin D synthesis. Dietary sources. Certain foods are naturally rich in vitamin D, including fatty fish, such as salmon and mackerel, cod liver oil, egg yolks, and fortified foods like milk and breakfast cereals. Supplements. Vitamin D supplements are commonly recommended, especially in regions with limited sunlight exposure or for individuals with conditions that hinder adequate synthesis. 4. Vitamin D deficiency. Bone disorders. Insufficient vitamin D levels can lead to bone disorders like rickets in children and osteomalacia in adults. These conditions are characterized by weakened and soft bones. Increased infection risk. Vitamin D deficiency is associated with an increased susceptibility to infections and a less effective immune response. Muscle weakness. Inadequate vitamin D levels may contribute to muscle weakness and pain, impacting overall mobility and strength. Mood disorders. Some studies suggest a link between vitamin D deficiency and mood disorders, with low levels being associated with conditions like depression. 5. Recommended daily intake. Varied needs. The recommended daily intake of vitamin D varies based on factors such as age, sex, health status, and individual needs. General guidelines often suggest 600 to 800 IU, international units, per day for adults. Supplementation guidelines. In cases where sunlight exposure is limited or dietary intake is insufficient, healthcare providers may recommend vitamin D supplements. The dosage is personalized based on individual requirements. 6. Sunlight exposure and safety. Balanced approach. While sunlight is a natural source of vitamin D, it's essential to balance exposure to minimize the risk of skin damage from UV rays. Short periods of sun exposure without sunscreen, typically 10 to 30 minutes a few times a week, are generally sufficient. Sunscreen use. While sunscreen is crucial for skin protection, it can reduce vitamin D synthesis. Individuals are encouraged to find a balance between sun safety and obtaining adequate vitamin D. 7. Conclusion. Vitamin D stands as a vital nutrient with diverse roles in the body, contributing to bone health, immune function, and overall well-being. Whether obtained through sunlight exposure, dietary sources, or supplements, maintaining adequate vitamin D levels is fundamental for optimal health. As with any nutrient, a balanced approach that considers individual needs and safety measures ensures the benefits of vitamin D are harnessed without compromising overall health.